Assalamu alaikum, everyone. This is Qudsiya Siddiqui from Imana. I am joined with Dr. Farha Abbasi today for an important webinar about faith and mental health and how religion and spirituality affects our resilience and wellness. A little bit about Dr. Abbasi. She is an assistant professor in the Department of Psychiatry at Michigan State University and a staff psychiatrist. She immigrated from Pakistan and 2000. Her areas of interest are cultural psychiatry and teaching medical students how to provide culturally appropriate care to Muslim patients. She works with the Muslim American community to encourage integration rather than isolation from mainstream society. She has established the Muslim Mental Health Conference and is the managing editor for Journal of Muslim Mental Health. Thank you so much, Dr. Abbasi, for joining us today for this important webinar. We're excited to have you on board. And inshallah, we'll start with your presentation now.
Thank you so much for that great introduction. And especially thank you, everyone who's tuning in and sparing this 1 hour of their evening to listen to this lecture. But why I think it is so crucial and important for us to really focus on mental health is that we already were anticipating that depression will be the second most frequent cause of disability worldwide, second only to ischemic heart. People aged between 15 and 44 years, depression is the number one cause of disability, followed by alcohol consumption. This was pre-COVID prediction, right? And right now, this pandemic continues to prolong. We are literally seeing a pandemic of mental health illnesses unfolding as well. And when I say that, 1 in 5 are going to be impacted by mental illnesses and concerns during this next 12 months, or 1 in 4 probably, or another prediction is 1 in 3 might be impacted after the COVID-19. When I say that, it includes Muslim community as well. So we might have a lot of resiliency and have protective factors around us, but we are not impervious. There's no way that mental illnesses is not impacting us. So when we give the numbers about depression, bipolar, or schizophrenia, it includes us as well. And when I say us, it means it can impact our geriatric population, it can impact our adolescents, it can impact our children. So it is not an outside problem. It is our concern and problem. And we will really have to put all our energy and focus in at least understanding timely access of treatment, but also, yes, utilizing all those protective factors that we can to prevent further deterioration or further complications of mental health concerns. It's interesting when I talk about mental health, the biggest barrier in access of timely care still is stigma. And that stigma is very prevalent all over the society. That's why we see that our health policies are not inclusive for mental health. So most of the states have mental health parity, which means you have equal coverage for physical and mental health. But in reality, that might not translate into providing you the care you need. On the other hand, this stigma also impacts number of psychiatrists that we have, right? So there is a huge shortage of psychiatrists in the country. I just was reading a report. 60% counties of United States of America does not have a practicing psychiatrist. In Michigan, 30 counties don't have a psychiatrist. And if we trickle it down, translate it to Muslim providers, you can see what dire situation we are in. Another problem, so that stigma already is the barrier in accessing timely care. But when it comes to religious communities, and especially when it comes to our Muslim community, this stigma is just heightened because we have this distorted belief that mental illnesses are a Western phenomena. It has nothing to do with our culture or our religion or our society. It is a problem that's happening out there. And that is the biggest barrier I see. So when I start working in this Muslim mental health field, the biggest thing I had to work on was creating this awareness, what mental illnesses are, and acceptance that it is impacting us as well, be it mental health concerns, illnesses, substance abuse, or suicide. That is becoming a big reality. And we can't really anymore deny or bury it in silence and shame. So that's why when I started doing my research on Islam and from mental health perspective, it was so surprising to me that Islam is one religion that is basically putting so much emphasis around mental health that I almost feel like if you are not mentally healthy and competent, you can't be a practicing Muslim. So Islam was the first religion that identified mental competence. If you are mentally competent or mentally incompetent, that's where the word majnoon came in. And your duties, your responsibilities, your practices completely change from being responsible for your wellness to being majnoon, mentally incompetent. So the more and more I read Quran with meaning, translation, and understand, the more I realize how important, how much emphasis is put on your mental health. Okay, and this is what I realized when I looked up Maqasid Al-Shariah. So Sharia literally is the path, right? The path that we are supposed to follow. Sharia is understood in two ways, right? Our relationship to God and our relationship to each other. And there are some basic fundamental concepts that are very important in Sharia law. So one thing is protect and preserve your faith, protect and preserve your life, but protect your intellect. Preservation of intellect is a fundamental concept of Sharia. And then, of course, children and money, nasl and mal. So imagine that your preservation of your mental health, your intellect is being put under faith and life. After your faith, Aqidah, life, your ability to protect your intellect. And they're saying preserve and protect. This means we are responsible. It's our duty to preserve, augment our wellness by keeping our intellect together. A lot of practices in Islam are then prohibited. Why was substance abuse prohibited? Intoxication prohibited? Because it will compromise your competence, your ability to make decisions. Why was anger made haram? Or why was any action taken in anger was haram? Because it compromises your competence. So preserving your akal, your mental health is an important tenet of your Islam. It's a duty on every practicing Muslim to take care of it. And I've talked about this a lot, that two integral concepts in Islam, wellness, welfare. This is what defines our resilience. This is what defines a Muslim family, society, or community, or whole ummah, wellness and welfare. If we look at any practice in Islam, it starts with an individual wellness and then is translated to the welfare, from individual to the community, from the community to the individual. That's why being in Ummah was such an important piece of Islam. If we take the example of Salah, 5 times Salah, right? Imagine right now, they are already talking about that sitting down, not moving around during the day is like being exposed to some carcinogen, not actively moving around, taking breaks. So even if you have seen Even in our society today, there is a concept like even when you're working on computer, take a break or stand up and do your work or take a break. Automatically, this was integrated by Islam by saying 5-time prayers. And your prayers are very physically activating and mentally rejuvenating. What are you doing? What are your prayers? You do wudu. What is wudu? First thing is welfare, hygiene, cleanliness. But what's the wellness part? Wellness part is you are putting water on your stress points. When you run water on your stress point, you are already feeling the calming effects. So you start with this. And then what are you doing? You are meditating. You are doing yoga postures like, what Hatha yoga kind of is sun salutation, putting your head on the ground. All that is integrated into namaz. And when you stretch your back, your muscles, your shoulder, where you carry the stress, when you are saying prayers, you are stretching all those muscles and the blood is going to your head. That is the wellness piece. What's the welfare part? When you pray and you stand together, it's the biggest lesson in equity and equality. Irrespective of who you are, where you are, when you stand in a prayer, everybody is equal. And you become aware of each other. What's going on in our life, your life, what's happening around us. You are supposed to be. You are getting familiar or know what's happening with your neighbor, your family, your friend. But what is another huge important piece of it? What happens when you are depressed or anxious? You tend to isolate. You tend to give up on your relationships. You tend to break away from things. And this 5 times coming in community and praying, or even if you are not in community, you are at home, coming out of the room and praying, or coming out and being with your friends to pray, any way that you are practicing it, you are breaking this isolation. You are coming out. You don't feel alone. Another benefit, when we pray and put our head on the ground, we are giving up all the power to an Almighty, right? So even if I'm working on something very anxiety provoking or something traumatic happening in my life, or I feel helpless, what is depression's literal definition is learned helplessness. But when I'm praying, this learned helplessness actually becomes positive because I might be helpless, but there is a higher authority taking care of me. That's such a huge gift and benefit in a society that's run on control and predictability, where we feel like we should be in control of everything that's happening in our life. When something traumatic happens and that control is disrupted, it is very difficult to keep your mind sane and healthy. And to have that luxury that, okay, I am helpless, you help me. We are doing our ibadah, you help us, right? We are asking for help from you, you help us. So, and already your burden is picked up. Look at fasting. We are promoting it, right? Everything that was in Islam and our religious practices is being promoted right now as practices of health and wellness in the society. Intermittent fasting. Everybody is talking about intermittent fasting. And that was already part of our religion. So there's a prescribed month of Ramadan. But anyhow, every month you are encouraged to fast a day or 2 days whenever you can. Another concept, don't eat till your stomach is full. Leave your stomach half empty. Hadith, right? Another part of Sharia. One part is based on Quranic teachings, and other is what we saw Prophet ﷺ practicing. So this fasting, wellness, detoxifies you, makes you healthy. You are eating less. You are eating healthy. You are more aware of your bodily functions. But what's the welfare of it? That when you go hungry, that's when you really realize how people around you must be feeling when they are starving. Then you are encouraged to open fast in a community setting, or even if you are doing it at home, think Send food to your neighbors. Send food to those who can't afford it. Share your meals. Share your resources. Same thing with zakat. Share your resources. Spend on yourself, but think of others. Think of welfare. So this wellness, this welfare is very integral. When we were stopped from substance use, alcohol, smoking, and yes, smoking is being prohibited by a lot of Islamic countries now. Initially, it was felt that it is legal and there's no exact wordings in Quran to prohibit it, but actually anything that harms you is prohibited in Islam. So a lot of Muslim countries are now interpreting and prohibiting that. But again, drinking, khamr, anything that makes you lose your competence, khamr is prohibited. Other substances, anything again, right? So be it substance use, be it any other practices in society, everything is very thought out. People ask me all the time, why was pork prohibited in Islam? Imagine at that time, you couldn't cure the pork or the ham, right? So there was tinea, the parasite was in the meat. It wasn't considered healthy. So people would eat this uncured pork and get epilepsy, seizures. And so at that point, it was said that it's prohibited because of health issues, but also because it was considered that pig is not a clean animal. But also the fact that when now science is proving that genetically pig is the closest to human DNA, right? That's why we are now trying to develop organs in pigs so that they can be used for transplant. So a lot of things that we are finding out now were already explained in Islam. Drinking water, the practice of drinking water before the meal, then early morning and sleep cycle, maintaining a sleep cycle, all this meditation, thankfulness, gratitude, such an important part of our, right now, if you look at the 6 or 7 habits of successful people, gratitude is such an important piece of it. Just always being thankful instead of, and that's where it brings me to the concept of sabr, right? So we interpret it very wrongly that sabr means something passive, that whatever is happening, you give up, you just sit down and say, let's persevere. Perseverance is a very active form of ibadah. Perseverance does not mean that if something is happening, don't do anything about it. Don't just sit and complain about it. Actually do something about it if you can. If there isn't something you can do to protect yourself, access health, go and work on some situation, do that. Because perseverance just means that do your best, but keep your faith in Allah. Don't complain. Don't constantly say, why is this happening to me? Why don't I have this? Also, all the time, it was being integrated in our mind that always be happy and contented with what you have. And if you are feeling dissatisfied, don't look at people who are higher than you, look at people who are lower than you. So this concept that be content with what you have. And if there is strife, because at the same time, constantly there is a reminder that you would be tested. And imagine how our prophets were tested, how they gave us the example of staying steadfast in face of all the opposition and wars and deaths and famine and poverty, and especially our Prophet Sallallahu Alaihi Wasallam, how he was tested. He was orphaned, he lost loved ones, he lost his kids. So that's where the gratitude and being contented comes. But the persevere does not mean just sitting passively and not doing anything about it. Doing everything with the faith that the outcome is in hands of God and that I would be happy whatever the outcome is. Even what appears bad might be good for me and what appears good might be bad for me. So ultimately, the decider is Allah, and I will be happy in His will. I will submit to His will. And that in itself is very empowering message. And it keeps you positive, right? That yes, I have the ability, and then I there's a higher power taking care of me in the end. So constantly, periodically in verses of Quran addressed to Prophet Muhammad sallallahu alaihi wasallam or other prophets, constantly there is a message: don't lose heart, don't be hopeless, keep your faith, because with every hardship, verily, with every hardship, there is ease. Not after hardship. I used to have this misconception that once the calamity is over, you will have ease. Actually, it's very interesting that during that period of strife, if you continue to use your belief and continue to work towards betterment, but continue to have that faith, that strife turns into ease for you. So in every strife, there is ease. So imagine what a gift of resilience it is for us to know that even strife and struggles is not bad for us. It clearly says in Quran, either you will be rewarded in this world or afterworld. And that every strife, if you knew how it takes away strife, illness, sickness, takes away all the sins from you, you would be thankful. So this ability to have gratitude, the ability to face challenges with steadfast and courage and faith and belief that there is a higher power, there's a meaning behind it. Because another thing that happens in depression, anxiety, everything looks meaningless. Why am I doing this? Why not give up? Now I come to the concept of suicide, right? That's a very tricky topic because we know suicide is prohibited because it is taken as sheer act of hopelessness. But again, it's so interesting if you go and read historical narrative, there is very clear demarcation between being competent, mentally competent and giving up on Allah. That was forbidden. That if you have all your strength and you have the capability, then don't give up. But if you are struggling with depression, anxiety that's affecting your mental competence, then if you act on it, there is forgiveness for it. There are historical narratives. There was a Sahaba who was really wounded during a war. And when he got so wounded in sheer act of hopelessness, he just took the sword and killed himself. And Prophet was very upset with that incident. That was sheer act of hopelessness, right? Meanwhile, there was a Majnoon in the society around him who was hurting himself, chewing on his hands, cutting his hands, and he died. And then Sahaba dreamt and saw him in heaven. And they came to the Prophet and said that, was he forgiven, right? Was he completed suicide? How is he forgiven? And the Prophet's words were, God is the ultimate knowing one. So we cannot be judgmental. We cannot say that suicide is something that you are willingly doing or you are indulging in a behavior that's anti-Islamic. We need to take a step back and understand, why does somebody do it? And how can we prevent it? How can we bring this faith, this knowledge, this love, and make sure that the person does not get to that point of losing mental competence and acting on this impulse? Then we also see that we continuously struggle with this concept that mental illnesses are spiritual weaknesses, right? That God forbid, if you accept that you are depressed, anxious, then everybody tells you, go pray. Why aren't you praying more? Your faith is weak. It's not like that. Mental illness are not ethical, moral, spiritual failures or weaknesses. It is a medical health issue like your physical health. More hard to endure because it's not visible. But the psychic pain, the conflict, the hurt is as real as somebody was cutting. If you had a broken arm or you had cancer, it is the same intensity of pain It affects all your systems from brain structures to health, to immunity, to growth. It is a serious disease, serious health issue. And it's not only Muslim community. This is something I endure and see in a lot of religious-based communities, the same concepts. Also, what happens, it's very interesting, whenever there is a calamity, we immediately question God. Why me? Why did you do this to me? So any struggle, mental illness can turn into a spiritual challenge, or your spiritual challenges can lead to hopelessness and depression. So there is an overlap, but not same. They are not same. You might be having a crisis of faith, irrespective of you feeling depressed, anxious, bipolar, schizophrenia. Two very different things. And yes, I always talk about it. Mental illnesses are on a spectrum. Situational depression, anxiety, to recurrent major depressive disorder, bipolar, schizophrenia, more serious and serious, right? We can think of any struggle, and mental illnesses also are considered, oh, am I being punished? Strive is not punishment. God said you will be tested, but illnesses and diseases are not our test. So this is another concept that I see in the community. If we see somebody thriving, doing well, maybe money-wise, education-wise, we say, oh, he must be a good human being. And when we see somebody suffering or in problem, or somebody's kid who might have gotten into substance abuse or something, we blame them or the child, like something is wrong with you. You must not be favored by God. I've seen this a lot of time. People will say, oh, that's why this happened to this person. He deserved it, or he wasn't a good human being, or he did this, so he's being punished. That's not how our religious system works. Think of Prophet Muhammad sallallahu alaihi wasallam. When he was in Badr, Jang-e-Badr, when he won Jang-e-Badr, the biggest battle for Muslims. It was the first big battle that we won. First victory. What is the first news he gets? He finds out that his son passed away. So who are we to complain of strife and being tested? And it's again, that's where the concept of perseverance comes in. That is where your sabr comes in. That instead of taking these challenges and strive as being punished, you say, Alhamdulillah, Inna lillahi wa inna ilayhi raji'un. To God we belong, and to God we go back, return. So these are all where your positive psychology comes in, perseverance comes in. That's what the concept of sabr is. It's very interesting that more and more religious communities, when people from belonging to a faith community, when they have psychotic breakdowns or have obsessive compulsion disorder, which interestingly, OCD was described long before it was acknowledged in Western society. It was described in Islamic literature. And that brings me to the point that Avicenna was the first one to describe mental illnesses, first one to create mental health friendly treatment centers. The first mental health hospital was built in Baghdad. Then Al-Razi describes a lot of mental illnesses long time before. They were big scholars. They did not say these were spiritual weakness. They gave us a medical basis for this. So same way, OCD was described in literature long before it was a part of DSM-V. And if you see obsessions, if you go to Kul A'udhu bi Rabbin Nas, Malikin Nas, Ilahin Waswasil Khannas. So it's in some literature, it's like these are whisperings of devil. So these obsessive thoughts are actually whisper that devil whispers in your ears to take you away from praying or take you away from happiness. Or so it's described as that, but very clear description of OCD is from medical point of view is available. So we see this, that if you belong to a religious community, the chances are when you do get these delusions that these become more religious in flavor. Like you'll feel God is giving you commandments, or God is directly talking to you, or God is telling you to do this. So these voices, these delusions become very religious, and it becomes really hard for somebody to differentiate that, am I going through a spiritual experience or is it a mental illness? And that's where it is important that we bring in Islamic scholars and we bring in faith leaders in this conversation, so that if your patient belongs to a faith-based community, it is important that both mental health provider and faith leader come together and differentiate what is spiritual weakness or spiritual possession and what is delusion, right? It becomes important. This brings me to another concept, the jinn possession. That's the more I do research on it, it's very interesting. So you will see some scholars feel that jinn possession is not part of Islam. So we do believe in the existence of jinn, but they are not harmful to us, right? There is one concept is that this jinn possession was something that we inherited from old European societies where demonic possession was part of mental illness spectrum. But I also saw, if you go and talk to a lot of scholars, Malik Badri, or, you go to Malaysia and some of the Muslim countries, they believe in jinn possession, but they also understand that jinn possession is not mental illness. So in any way, this concept that we have that mental illness or psychosis as jinn possession, it is only happening where there is no awareness or there is no education about Islam. There is no literacy around Islam or literacy around mental illnesses. Being Muslim as a mental health provider, we need to understand that there will be, like Muslims are diversity within diversity, right? We don't have a standardized Muslim community or patient, right? Our religion intersects with cultural practices, cultural beliefs. So there is something, culture of Islam, which is based on religion. And then there is Islamic culture, which gets adapted and impacted by different cultures where Islam is being practiced. There is this belief that there is a big Muslim community that believes in jinn possession and uses Quranic verses like Ruqya for possession, while others don't believe in that jinns are harmful to us. But either side, we have to be very clear that mental illnesses are diseases, a health issue. It has nothing to do with jinn possession or spiritual weakness. This is so finally, psychiatry, psychology, everybody's understanding the importance of religion in somebody's wellness or somebody's distress. So we have to also understand that it is important that religion, when you are taking a history or you are evaluating a patient, it is important to take in consideration their faith and religious practices, or if it is spiritual practices, whatever we have to take in consideration. Because again, it can be source of your resilience or it can be source of your distress. And how? Imagine this, that a lot of our youth will tell you, we are afraid to go to Islamic center and to be not accepted, not included. Or you will hear a lot of families say, I can't talk about my son or daughter's depression in an Islamic center, or I can't talk about it in the community, right? We have to understand that, yes, Islam and faith are very integral and important parts of us, but if it is not being used in a healthy way, if it is being used to criticize, to judge, to punish, if we make it punitive, then it can be a source of distress instead of source of resilience. So anyhow, DSM-V does have this spiritual problem category, but it is based on the fact that somebody who is struggling with religious issues, or is converting and that is causing depression, or is experiencing loss of faith and that's affecting depression and anxiety. So that's what they are talking about. So psychologists would tell you that in our mind, there is almost like a jury is sitting there. So kind of a jury is deciding if you're doing well or you're doing bad, good, bad, right? And this jury is something we have picked from childhood. It could be father, it could be some family or community. So that's where the religious leaders become very important, and their role in our development becomes important. So somebody who has committed an act that he or she feels that is sin, but more than God, we are scared for the faith leaders to be punitive towards us or judgmental or criticize us. We are more afraid of the community to find out. We are not afraid that God is seeing and finding out about it. We are more afraid because we as a society and community have become very judgmental. We have this cookie cutter image of a Muslim kid, a cookie cutter image of a Muslim woman. While when you read Quran, God is very accepting. God constantly in Quran says, come to me. Whatever you have done, however you have faltered or failed, come to me and I will forgive you. So this is something I talk about is so important, especially people who are suffering from mental illnesses or their loved ones are suffering. Maybe addiction is very much part of your mental illnesses. Your depression, anxiety can lead to unhealthy coping. And the more we keep it secret and shameful, more and more people will go towards unhealthy coping skills, use drugs to combat their depression, anxiety, and bipolar symptoms rather than access timely care. So we as just having the community is not important. Having a supportive, loving community is important. Having an inclusive masjid is important. Having open-minded faith leader is important that understands that it's human nature to err, make mistakes and falter, but ultimately God is the ultimate forgiver, the healer. So if we are gonna just focus on the punitive sides of sin and Jahannam and punishment, then the people who are suffering with bipolar, you become so impulsive, you act out, you behave in a very a manner which is not acceptable to society. And if they cannot find solace in a religious institution, a religious community, then where would they go? Right? So it's important we understand that it's not only community, having a supportive, loving community is integral part of our resilience. And what we see, because we do not have clear concepts of mental illnesses, this is what we see is that if you are having a mental health breakdown, you might first seek care from a faith leader or elder in the family or community. And there is concept of spiritual healing. There are sheikh that kind of can give you verses and duas. And also there are Sufis that give you spiritual healing. But this I'm talking about mental health crisis. Somebody going through a crisis might reach out to the faith leader before they reach out to a psychiatrist. And then also they might go to primary care first, because a lot of when there is so shame and stigma, that a lot of times mental illnesses present as somatization, pains, weak headaches, and nobody comes out and say, oh, I'm depressed, I need help, right? So what happens is mental health comes in moments of severe crisis when it's already late. If they are having a psychotic breakdown, or if they have already in a legal binding, or have really abusing a substance. So we need to create this cohesive models. Ideally, my hope is every faith leader gets mental health training. And I know chaplaincy, if you are certified under chaplaincy, they are making mental health an important part. But our imams are on a spectrum. my hope is not only that, but that every Islamic center should have counselor or a system, a mental health system in place, crisis hotline. We should be training community leaders as mental health aides, so support, where we can pick the symptoms like who is decompensating, who needs immediate help. So we have a very successful model at East Lansing. The Imam and I refer to each other, and a lot of that model is being replicated in a lot of places. Adams Center now has a whole counseling center in DC, amazing work being done there. I always talk about Imam Majid, and the work that's being done there is amazing. But coming back to, it is so important that community leaders and faith leaders know what to look for. And recently we had a situation where somebody felt that they are having spiritual experiences, was referred to the Imams, and Imam prayed with him, but also could see psychosis and referred him to me. So that's how we cross-refer to each other. Another case where I had to refer to Imam was that a young Michigan State student was going through a lot of crisis of depression, anxiety, and felt really alienated, isolated, because he felt he never got a chance to be in main American society, and wanted to be like an average American kid, drink, date. And he started doing that. But after a while, he realized that that's not him, and that the religious values that he felt that were imposed by parents were actually something very important to him also. So now he was feeling very guilty, very anxious, that now I'm going to go to Jahannam, I will never be forgiven. So that mental illness became a spiritual crisis, right? So I referred him to Imam to pray and to explain him the concept of forgiveness in Islam. There are so interesting case that there was a woman and she delivered a baby in early hours of the morning and became psychotic, postpartum psychosis. Instead of calling a psychiatrist, they called the Imam to pray on her. And Imam was discussing this case with me and said, "Sister, it wasn't me who needed to be there. You should have been the one called." And I said, "No, thank you. Early mornings, early hours of the morning, I'm glad you were called first." So it is important that we create and strengthen this model, that we stop this demarcation between religion and mental health. We need to integrate them, bring it together. And it's not only mental health. I think the benefits of the resiliency of having a positive psychology around you. Another thing is the attachment theory, right? Bowlby talks about that this innate sense of belonging, this object that we feel that kind of comforts us. For us, that is like religion. Religion is our attachment, right? We define our identity. So if religion is not part of our healing, then it is going to be part of our sickness. So we really have to work on bringing and creating this model. This is a picture from one of our conference about the training. So we have done substance abuse training with Imams, first aid, mental health. Now Islamic psychology by Khalil Center has been very important. Wellness training by now the Black psychology, Camila Moment, she used to do trainings. Then we have invited Red Cross and Human and Health Services to create a trauma-informed congregation. So I keep thinking of innovative ways to bring these imams in this conversation. The idea is not that they don't become the mental health providers, but at least they can then pick early on, early intervention, they can see where it is spiritual issues and where it is mental illness. Same way, I might be practicing Muslim, but I'm not standing on the pulpit. I don't have ultimate knowledge. Alhamdulillah, we do have now providers like through Khalil Center that they have both. They have the Islamic knowledge and are mental health providers as well. But most of us who identify as Muslim mental health providers, we are practicing Muslims, so we can at least have an understanding and insight into cultural issues, right? But it is important that to understand that in the end, I don't have the full knowledge. So it is important that we continue to have our identified roles, mutual respect, and with boundaries, that I don't cross over and start interpreting Quran, and that they don't come and say this is not psychosis, right? So mutual respect and boundaries. But I think there is no other way to go forward. We need to create these models in every Islamic center and masjids. Thank you.
Thank you, Dr. Abbasi. That was a great presentation. We are so glad that you presented it so well and talked about this very important topic and dwelled into so many different aspects, that there's such a thin line between each of this and how religion intersects with mental health. Thank you so much for that in-depth presentation. We do have a couple of questions if you would like to answer. So, you discussed about how important it is for someone to have a therapist who shares the same faith as you, because, that creates a level of understanding, and also it helps guide that person in the right direction. So, what would be your opinion on that?
So, look, again, there is pros and cons of cultural pairing or religious pairing. It is what you are needing. If you are needing that religious flavor and you need that religious understanding, yes, do go and find a Muslim provider. First of all, that becomes a challenge, right? There are not enough. But sometimes imagine, and I run into this problem a lot of times, we all belong to a small community or a masjid or Islamic center. There becomes of course, as a mental health provider, you have sworn in, like it's part of your HIPAA to keep the privacy. But the child or the girl or the woman talking about domestic violence might not be comfortable opening up to somebody from the similar culture, thinking that I would be judgmental. So it goes both ways. I think it is important that you as a client kind of first take in account what is that you are hoping to get. Where would you feel safe and heard and not feel violated or invalidated, right? I also run into this thing with my Michigan State students, this Desi auntie thing, that the concept of the Desi auntie with gossiping and criticizing, that they are worried opening up to me sometimes unless they talk and understand where I'm coming from, right? So it can go either way. And also think of it this way. You might have to talk to few therapists before you find the right one. It is same thing like a provider for your physical health. Sometimes we immediately click and like a provider. Sometimes we are not comfortable. Something they say or do bothers us. So yes, you should be open, and if you have to try one or two, again, but find out what your needs are.
Great. Yeah. Thank you so much for that. Another question is that, you explained that there is, it seems like there's a very pretty thin line between mental illness and recognizing spiritual failures. Because it's just so, every time it's just seemed that, you have to pray more often or read more tasbih to, not distract yourself and go into this phase of depression. So there's a very thin line that, towards, right?
I would say it's a very distinct line. It's a very distinct, very clear demarcation. Think of it this way. I give example of diabetes, right? So when you are pre-diabetic and you go and talk to your provider, first thing they would say is cut down your stress, change lifestyle changes, meditate, change your diet, right? they don't put you on medication right away. Then comes a point that you need medications. Then comes a point you need insulin when it gets out of control, if life changes or not. So same way, there is a point, like situationally, you have lost a loved one, or failed an exam, or not getting admission, or breakup of a relationship. A situational thing that, yes, praying can be helpful, right? But there comes a point where it is not just sadness, it's clinical depression. And when it is turning into a disease, it is important that you access care and get proper treatment. That doesn't mean you stop praying or doing whatever is healthy, sleep or taking diet and praying 5 times. That doesn't mean you stop doing that. But important pieces, knowing where prayers is enough and when extra medication is needed. I always talk about it, simple way to identify clinical depression, take into account last 2 weeks of your life and see if you have been more happy or more sad. If there are days that you have been more sad than happy or yourself and you're not enjoying life, I would highly recommend to get in clinical evaluation.
Perfect. Thank you so much for explaining that. I truly appreciate it. I think that's about it, and we're almost near time. If there's any closing statement that you would like to share, I loved your advice on, getting masjids involved and our Muslim leaders at the masjid involved in this initiative. I think it's very important, at least for our community, to come up at the forefront of this and discuss this rather than bury it back, where an individual is just so burdened with handling it by themselves and not knowing an avenue to express their concerns.
In my ideal world, I would see that, how after Friday prayers, after the khutbah, how you pray for people who are struggling, have maybe had heart attack or are hospitalized or something, surgery coming up, how you pray. I hope we come to a point that we can openly pray for people who are depressed, who have attempted, who are breaking down. Why we as Muslims have become an ableist and judgmental society, I don't understand it. When constantly your religion is talking about taking care of those who are vulnerable. We were not supposed to focus on those who were doing well and thriving and talking about them. We were supposed to focus on those who need us. So why are we not turning that model for mental health awareness, for mental health wellness? Those who are struggling are also good Muslims. They need us more than those who are healthy and successful. That would be my ending message, that please don't separate mental illnesses. We need to dispel the stigma because, again, 1 in 4, when I say 1 in 4, it is our children, our loved ones, our spouses, my parents that are getting impacted. So more we open up, and if we save a life, it might be a life of someone we know, we love, or even your own life. There cannot be health without mental health.
That is amazing. Thank you so much for sharing that important message. And, we also hope that, our masjids and our families recognize this issue. And, I hope there's a change, especially after they see this webinar and get in touch, opens their eyes into this topic more. Thank you so much, Dr. Abbasi, for your time.
Thank you.
Appreciate efforts in talking about this, and we hope for a positive outcome as well.
Inshallah.
Inshallah. Thank you so much. Thank you so much, everyone, for joining us.
Good night.
Good night. Assalamu alaikum.
Wa alaikum salam.